751 at 97.3 FM WVLK, and from our Auto Tech Service text line, Sandy says we need to put a single light in our windows like it was done during the war.
Oh,
Kind of a nice idea.
that would be kind of nice.
You don't want to get out there and put your whole Christmas light display up.
Because, it's kind of a lot.
It is a lot.
Yeah.
All right, we've got our expert with us now, Dr. Kevin Kavanagh. He is the founder of Health Watch USA, a retired physician. And good morning to you, Dr. Kavanagh.
Good morning, Jack.
Please bring us up to speed on the latest information from the CDC.
Well, that's actually one of the problems. The CDC needs to get more to the forefront of this fight. But the latest information we have absolutely is not good. In the United States, we have over 35,000 cases, over 450 deaths. New York City is being hit the hardest. In Kentucky, we have either 100 or over 100 cases. We have 3 deaths, and just announced in the Lexington Herald Leader this morning, a 26-year-old medical student from UK is in the ICU. And that is not good. How many times have you heard if you get the flu, you'll be wind up in the ICU if you're a 26-year-old? Pretty rare. This is much more dangerous than the flu. And also, Rand Paul came down with coronavirus, being tested positive. He's asymptomatic. Now, last week, we had talked about asymptomatic carriers, and I'm sure I was called alarmist. Well, you've had Republicans yesterday that missed probably one of the most crucial votes of their career because they were exposed to Rand Paul, an asymptomatic carrier. So this is a concern, and this is one of the reasons why people need to wear masks when they go on the outside, not so much to prevent you from getting the virus. You're not in full hazmat gear, but if you are an asymptomatic carrier, it will help not to spread the virus to others. And also, it reaffirms the governor's guidance to stay at home unless you absolutely need to go out.
There was a text we received from a listener that said that was a U of L medical student.
Oh, I'm sorry, U of L.
Yeah.
Stand corrected.
So you keep telling us it's worse than you thought. Is that what we're looking for the next several weeks?
Well, Jack, I'm afraid it may be for a few months.
Really?
I don't know if they'll be able to shut this down in a few weeks. Yes, there's not only asymptomatic carriers, there is starting to be growing concern that there may be some asymptomatic spread. It is much more contagious than the flu. That was gone over by Vice President Pence during the press conference on Friday. So this is going to be for a long haul. People really need to change the way they're living. If everybody would stay home in the entire world for 2 weeks, the thing would go away and burn out. Or 2 weeks, extending after you have either recovered or have the virus. It would absolutely burn out.
Do you think the governor should issue a shelter-in-place order?
Right now, I think I'm getting close to that. Again, we've gone over that. It is better to do these orders before you get the virus than after you get the virus. But a number of states are cutting down on travel. They're having shelter in place, etc. It's a very, very tough situation, and people need to be very careful. Certainly, if you can, try to order your groceries to be delivered. We're just ordering non-perishables. We're personally having them placed in the garage and leaving them there for 3 days and then taking them inside. But again, that has to be non-perishables. You've got to be pretty careful. This can be highly infectious. The virus can live on plastics and stainless steel for up to 3 days.
All right, we're going to continue to rely on you to keep us posted, and we'll talk to you on Wednesday, and thank you very much.
Thank you, Jack.
That's Dr. Kevin Kavanagh, and we'll be back after an update from the information